Good evening and welcome to Special Assignment. I'm Ashraf Garda. Tonight we tackle a sensitive but very important issue concerning children. The Saturday, the 24th of March, is World TB Day, and we highlight the problem of pediatric TB in South Africa, a disease that threatens the lives of our nation's children. Now, despite the health risks, it has not been a major point of focus for medical researchers and the health system in general. This report by Fatima Simji of Health E News Service.
1 out of every 15 babies born in South Africa will die before the age of 5. That translates into the death of over 200 children every day. We have no idea how many of these deaths are because of tuberculosis, because too often in children, the disease goes undiagnosed and untreated. In a country with the third highest burden of TB in the world, these are the forgotten children. Three years ago, Bonke was diagnosed with tuberculosis, and he's been battling with the disease ever since.
TB, what it doing inside your body? In your lungs, you feel, you take a space in your lungs. Sometimes you feel sick. Sometimes you coughing too much all the time. Yes, you're scared when you're sick because not playing, not talking, you feel sick, you feel like vomit. Sometimes you feel like want to sleep.
Children with TB get a cough and night sweats. They're feverish and lethargic, symptoms which can easily be confused with other common childhood illnesses.
Loss of weight, too much loss of weight, because he was weighing 56, the weight. But then he was weighing, when he was admitted, the weight that he was weighing, it was 29, from 50 to 29. So it was hurting to see your child when he was sick.
Bonke was in TB treatment for 2 years without getting better. Then doctors discovered that he had multi-drug resistant, or MDR TB. This is a strain of TB bacteria that's resistant to the run-of-the-mill drugs. So Bonke has been given a longer course of more toxic medication to cure it.
The time I see my child is sick, I was crying every day. I was told myself, why God is be my child to sick? What's the thing I do for my child? Or maybe I can take this pain for my child, because it was not nice that time I was seeing my child sick.
Like many families, Bonke isn't alone. Alpha Senior also has TB.
To be child is too worse because it's difficult even to you when you are older. So I think in child is too much, because every time you're tired and your body getting pains, you didn't eat, you're vomiting, you want to sleep all the time, you see, not feeling well at all.
Dr. Gary Rubinson is examining a little boy who has TB in his brain. While adults most commonly get TB in their lungs, children are prone to more severe forms of the disease, which can spread throughout their body.
The TB is a bacterial disease. It's caused by Mycobacterium tuberculosis. It's been around for thousands and possibly tens to hundreds of thousands of years, and we're still not in control of it. From a pediatric, from a child point of view, it's a disease that can affect anybody, but particularly young children, and especially young immune-suppressed children, and in our setting that's often HIV associated, are most at risk for TB. In addition to them, children with malnutrition and a few other underlying conditions would be also at increased risk.
Diagnosing TB in children is extremely difficult. Not only does the disease appear differently in children than it does in adults, but the tools available to doctors have changed little in the last 100 years. One method used are chest x-rays, but children don't always have the classic symptoms in their lungs, so the TB may not be visible. Another is to cough up a sample of phlegm or sputum from the lungs and test it for the TB bacteria. In children, this isn't always possible.
Children, particularly young children, if they do cough and if they do cough up sputum, will usually swallow that sputum. So it becomes much less accessible for the healthcare workers to get that sputum, to process it through the laboratory services.
But these results aren't always reliable because children have a form of TB where fewer of the bacteria show up in their lungs.
Even if we are able to get sputum from them, the number of organisms in the sputa is much less. And so therefore becomes more difficult for the laboratory to detect those organisms.
The choice of treatment depends on the strain of TB, but often this is a case of trial and error. Without any techniques designed specifically for children, diagnosis is left up to the doctors based on what they can see and the information they can gather from family history.
Mum was saying the child is coughing a lot, child is losing weight, they're having night sweats, and often enough, that's the first thing we want to query is TB, especially in like our community. TB is it spreads through the families as well. So like maybe the mom might have TB as well, somebody in the family, and you're in a small environment, someone's coughing, the baby's going to pick it up because their immune system is not as good as ours just yet, so they pick it up quite easily.
This 7-month-old baby shows symptoms of TB, but to confirm, he'll need to test her sputum. To do this, he has to stick a tube down her throat to try and get a sample from the fluids in her stomach. It isn't always successful.
It's an uncomfortable procedure. I mean, if you thought about somebody putting a tube down your throat to try and get a sample out, it's quite uncomfortable.
In South Africa, 500,000 people are infected with TB every year, thousands of whom are children. Despite being one of the top 10 causes of childhood deaths worldwide, little has been done to highlight the disease. So many are being diagnosed late, making treatment more complicated. Others die simply because it is never detected at all.
Children were largely neglected in that they were not prioritized in TB control programs, since they were not responsible for transmitting the disease or maintaining disease within the community. So children have been carrying a large burden of disease that has been unrecognized.
Coming up, we look at the treatment of children with TB.
This is Sizwe Hospital in Gauteng, where patients with drug-resistant TB are confined until they are no longer infectious. A poor TB control program, coupled with the high burden of HIV, means that South Africa faces one of the worst rates of drug-resistant TB in the world. And children are at high risk of contracting this potentially lethal strain of the disease. Some are only a few months old.
I think the biggest thing for us is that TB is not really only a medical illness. It becomes a very difficult social issue where kids are admitted in hospital. So it really does become quite a loss for the kids. They lose their families for a while. They lose their environment for quite a while.
Drug-resistant TB is curable, but it requires expert medical care to oversee the long and complicated treatment. These children will remain here for at least 18 months. Their healthcare workers have to wear masks to protect themselves from being infected. For children who need to feel affection, this limited contact can be difficult.
Also the stigma, I think, that's attached to TB, and I think especially to MDR TB, is huge. And their families and friends often are scared of them, or they don't want to come to visit, or they don't want to come close to them because they're scared of being infected. So I think that's also a very, very difficult issue to to having to deal with.
When Mlungisi's son Luando was diagnosed with MDR-TB last year, he was admitted to hospital. He's only 5 years old, and adjusting to his illness and treatment has been traumatic.
I was very sad because Luando is very young and I always with Luando. So if you take him to hospital to stay there alone, you know, if you got TB, you must stay in a separate ward. You must stay away from other people. So I was very painful. When we were leaving, he started crying, and he didn't want to stay there, and he didn't want to go to his bed. He was crying. That is why they gave it to us. They said, well, you must go to the nearest clinic.
Luando's life depends on this treatment, and for 6 months he had to go to the clinic every day.
I tried to explain to that TB is staying on the lungs. You can't see with naked eyes, only doctor who can see the TB. I tried to explain on that way. See, and then you must get injection every day, and then you must get your medication every day.
A year ago, Luando's aunt died of TB, so he understands the risk.
If he doesn't want to take the tablets, you just tell him you will pass away. You will pass away, you will dead, my friend. I just tried to explain to him. And especially he saw his aunt passed away. That is why he just takes his tablets every day.
Children with drug-resistant TB are given a treatment that was developed for adults. These drugs are extremely toxic and can cause severe side effects, sometimes even permanent disability.
A child who's receiving second-line TB treatment would be getting an injection a day for many months. And yes, the important side effects include hearing loss, which may be reversible, but sometimes is not. It's trying to strike the right balance between giving drugs we know to be toxic, dealing with their side effects, but also making sure we treat TB the best way we possibly can.
At this stage of his treatment, Luando isn't infectious to other people, so he's gone back to school. But Mlungisi still keeps a close check in case he develops any of the side effects.
Since he got TB, I like to look after him. Even after 1 month, I must go to his class and to find out he's very sensitive, and then he can hear very nice, he can see, you see. Otherwise, I have to tell his doctor, he can't hear, he can't see, you see. That is why I always come around on there.
Children with drug-resistant TB sometimes have to take up to 15 tablets a day, and no medication is available which caters to their needs.
Most of the second and third line agents that we use to treat drug-resistant TB, that's typically MDR or XDR TB, are not available in child-friendly formulations. And so we kind of forced to use the existing available adult formulations the best way possible.
In the last few years, however, developing new drugs to treat childhood TB has been given more attention.
So there are a number of new TB drugs in the pipeline, and it is encouraging that people are starting to recognize the need of formulations specifically for pediatrics. And so we need to remember, whilst we're developing these new TB drugs, that at the same time we need to look at pediatrics as a very special population, needing their own formulation, needing specific drugs, not just of the new TB drugs, but also of previous TB drugs, which need to be reformulated.
As the medicine does not come in syrup form, doctors are forced to estimate the doses of tablets for children. He's crushing the medication and mixing it with the liquid so it's easier to swallow.
It tastes very bad. That is why I mix it with the what you call multivitamin. Then I give him some fruit after that because it tastes very bad.
It's a lot of tablets, and Luando doesn't always react well to his medication. Sometimes he vomits, and this compromises the success of his treatment.
Children are dying of TB even when on TB treatment because some of them don't actually respond to the TB treatment. And that kind of highlights the importance of new drugs.
Children are most vulnerable because their diagnosis and recovery completely relies on other people.
I try by all means to look after him. Does he take the tablets? Does he take the injection? Because I know his life is dependent on me.
So why does TB remain a problem in our society? Answers after this.
This is Diepsloot, a township on the outskirts of Johannesburg. Overcrowding and poor ventilation in shacks makes this a breeding ground for TB. Children living in these poor conditions are easy targets for the disease. Johannes, a single father of 2 boys, was diagnosed with TB last year. Within months, he had infected his youngest son, Sifiso.
I see Sifiso is changing. He don't want to eat. He's not playing like another children. And then I think maybe he's sick because we sleep together in the one place. And he's coughing. All night he's coughing, he's sweating.
TB in children is largely transmitted to them from adults they're in close contact with, typically their parents, but also other caregivers.
This is the small room where they all sleep together, and probably where Sifiso contracted the disease from his father. It's cramped and has no windows, so when Johannes coughed, the bacteria was easily inhaled by his son. Johannes is also concerned about his older son.
See, Thokozani is changing because he's coughing like Sifiso. I feel the pain because he's a kid. He's not like me. Me, I can handle because I'm old.
TB has had a devastating effect on the entire family. Johannes has spent much of his meager income making costly trips back and forth between clinics, and Sifiso has been too sick to go to school for months, and he's falling behind.
They are vulnerable and they are reliant on caregivers to administer therapy to them, and both using HIV and TB as an example, their caregivers are often also unwell, and so that makes it even more difficult for them to administer therapy. And there's stigma attached to both of these diseases, unfortunately still, so that they may be reluctant to involve additional family members because that would reveal what disease either they or their child has.
Busi is a volunteer TB worker in Hammanskraal outside of Pretoria. The many patients under her care, often entire families, are reliant on her to oversee their treatment and help them recover.
How's my baby, Papa? Okay. What I normally do, I go to check my patient, and then when I arrive there, when they didn't clean the house, I start from scratch, cleaning the house, cooking for them. Sometimes where I go, sometimes I must have the mask to cover myself and the gloves, and then to wash them.
For the children with TB, poverty and poor nutrition made them more susceptible to the disease. It also threatens their chances of recovery.
Sometimes when I go there, they don't have food. I must make a plan. Before they drink the medicine, I must give them food.
If healthcare workers at clinics are not trained to spot the symptoms of TB, it's often confused with a common cold or flu.
When that granny goes there to the clinic, she tells the nurses that the child is coughing. Then they give them the medicine for cold. Because they go to the clinic time and again, saying it's cold, but it's not. When I go there, check that the child is not eating, is sweating, is getting tired. So I encourage them to go test.
Busi's own child had TB a few years ago, so she's more sympathetic to the children she cares for.
I blamed myself that why he has TB before I knew that TB is curable. Yeah, I was blaming myself.
In this house, Bussy helps to look after a 2-year-old orphan whose mother died of MDR-TB. She's also infected with the disease. Stigma is so severe, parents sometimes delay receiving treatment for their children, out of fear of admitting they have TB.
Sometimes they don't want to tell that there's someone who's sick in the house, you see. So you have to try hard to help that people in the house. They are hiding, that's why I'm saying sometimes it's not easy, because they are hiding. They are hiding that people are dying from this disease.
Programs like Bussy's tackle TB at its source by informing communities about how the disease spreads and what the symptoms are. Until new drugs and diagnostic tools for children are easily available, prevention remains key to controlling the disease.
Children, it's a shame on them, because they know nothing, they can't do anything, and if you don't take him or her to the clinic, he can't do it, because if I'm not there, who will help them?
If you suspect your child might have TB, consult your local clinic for an assessment.
Yeah.
Now, I'd like you to share your views on this issue, and you can do so via Twitter by using the hashtag Special Assignment. You can also Facebook or email us. And on Friday after 2 p.m, I'll be taking your calls in a follow-up discussion on my SAFM radio show. Well, on to comments about last week's program on the rape of Zimbabwean women at the border. Percy Mabitsela emailed, "I really got touched by the rape issues in Zimbabwe. Why doesn't our government send the army to patrol between the borders? The rape incidents will drop." And on Facebook, Kafilwe P writes, "These men should stop abusing their fellow country women. It's so sickening." Well, that's it from me. Join us again next week when we point out the issues that matter.